everyone. Welcome back to another episode of Pleasure Principles, the podcast where we dive deep into the desires, taboos, and truths that shape our intimate lives. I'm your host, Avik, and today we are going there. Like, ever trusted an STI test? Only to find out, it didn't test where it mattered, right? I mean, ever wondered, why public health still whispers when it should shout about sex, right? Today's guest is flipping the script. Please meet Robert Johnson. So, welcome to the show, Robert.
Thank you so much for having me. I'm really looking forward to it.
Amazing, amazing. So, Robert, before we start, I'll quickly love to introduce you to all the listeners. Dear listeners, Robert is the founder of Shameless Care, a revolutionary telehealth company born from a very personal and very frustrating experience. So, after contracting gonorrhea and testing negative, Robert discovered what most clinics won't tell you, like oral only STIs are rampant and throat swabs are often skipped. Yes. So from radically honest testing to doxypep, ED meds, swinging, and the real cost of building a mission-driven sexual health startup, Robert brings sharp insights and zero BS. So, dear listeners, let's strip away shame and take consent seriously and ask, what does true shameless care look like? So, welcome to the show again, Robert.
Thank you very much.
Amazing, amazing. So Robert, to start with, you have said that your journey started with a negative test and a very real infection. So, can you walk us through that moment, what it cracked open for you?
Yes, absolutely. So I am consensually non-monogamous, and as a result of that, I had gotten STI tested every 6 months or so and I'm here in the United States, so from a wide variety of providers, sometimes in urgent care, sometimes a telemedicine company, sometimes my primary care physician. And every single time it had been blood and urine, and out the door I go. Those were the two specimens that they had collected. And then I had a partner text me and tell me that I had given her gonorrhea and she had in turn given it to her husband. Now, like I said, everybody's consensual non-monogamy here. Of course, her husband knew about our sexual relationship. No issues there.
Mm.
But the truth is that I had harmed someone. I had harmed her, and then she had in turn harmed her husband. And the kicker was, as you mentioned earlier, I had just gotten STI tested, which showed that I was gonorrhea free. And she said, "Well, have you ever heard of throat swab testing?" And I must admit, I had never even heard of such a thing. So I said, "Well, I guess I better I better look into that."
Mm.
And the really crazy thing is I had to go to 3 different doctors here in the United States before I
Okay.
found one who knew what throat swab testing was. He throat swab tested me, and sure enough, I had a completely asymptomatic case of oral gonorrhea, and that really lit a fire under me because I don't know how it is in other parts of the world, but here in the United States, it's
Mm.
pretty safe to say that most people have unprotected oral sex. And I say that because you can go to a local pharmacy, any place that sells condoms, and you will not find a dental dam, the little piece of latex that people are supposed to use to perform oral sex on women. Those
Mm.
just don't exist outside of a few niche websites. So that alone tells
Mm.
you that most people are having unprotected oral sex. And then people go and get tested and they're not getting tested in the very place that they're most likely to have an STI. And now that we've been running our own STI testing company for 3 years, we have found that 80%, so 8 out of 10 of our positive gonorrhea cases are oral
Okay.
only. Their genitals would have tested negative, their throat tested
Mm.
positive. Every single one of those people would have walked away from that testing experience thinking they were STI or STD free when really
Mm.
they just weren't being tested properly. So it's extremely eye-opening, and I just wanna shout from the mountaintops so that everyone who has sex or every doctor, every clinician all around the world can hear this, which is when somebody's requesting STI testing, you have
Mm.
to test their throat.
True. Understood. Uh, So, okay, like when you realized your case wasn't a fluke, but a part of a systematic blind spot. So, did you feel kind of more rage or responsibility?
Oh, I definitely felt responsibility. I just realized how absurd it was, and I spent the next couple of years the last company that I had gotten tested with, and I won't name them because it doesn't matter, most companies test this way. I spent the next couple of years emailing them off and on, trying to get them to include throat swabs.
Mm,
And, I might have been talking to a low-level customer service person or something like that, I don't know. But I just quickly realized that companies were not going to start doing that for the simple reason that you can sell a test that says it tests for gonorrhea and chlamydia, and that's true, but genitally only. Well, if you're gonna sell that same test and also test the throat, you've now just doubled your cost because you have a genital test and you have a throat test. And if you're also going to test the anus, which a lot of people have anal sex, then guess what? You've tripled your cost, which means the product has to cost 3 times as much. And for that simple reason alone, I didn't think anybody else was going to do it. So yeah, I felt a big sense of responsibility. I've now invested my entire life savings into this venture, not because I think it's ever going to be lucrative. I guess there's a chance it will be, but I just felt like somebody had to do this, and if it wasn't going to be me, then who in the world was going
mm,
to do it?
exactly. Understood. Understood. Yeah. And like so definitely I think so many of us trust the system to be smarter than it actually is, especially with our bodies for sure. And when the system fails, it's often us who are left holding the bag, like whatever, like financially, physically, emotionally, anything. So what do you have to say on this?
Oh, I absolutely agree. People put a lot of power into this phrase, "get tested," or "I was
Mm,
tested," or "full panel." People go to their physician's office and they say,
mm,
"I'm sexually, active. Please test me for
yeah.
everything." And then that really should be all they have to say. But the truth
Mhm,
is, if you went to 10 different doctors and said that, you would get 10
mm,
slightly different STI panels.
yeah.
And so you really do have to take control as the patient, which is unfortunate. I don't go to the cardiologist and tell him how to be a cardiologist. I just trust that he knows how to do that. But I do think that whenever you're asking a physician to kind of proactively test you for every single STI you could possibly have, that really is a difficult question. And I totally see why some things are missed, certainly. So yes, if you're sexually active, unfortunately, you have to take a lot of control of the situation. And I would say the number one thing that people can do is realize that an STI panel is simply a list of infections and places.
Yeah.
And it might be helpful for the patient to walk into that doctor's office and not say, I want an STI test, but to say, I would like a gonorrhea throat swab. I would like a gonorrhea urine test. I would like a
Mm,
hepatitis, so on and so forth, and really kind of put themselves in a position of control and request what it is that they feel like they need.
true. Very true. Yeah. Wow. And like you built Shameless Care to do the STI testing, right? So no skipped swabs, no shame. So why is this level of honesty is very rare in the sexual healthcare? What do you have to say?
Oh, I mean, I'm not trying to throw anybody under the bus, but most of these companies are founded by somebody who may care, but really wants to build a business, and then funded by venture capitalists. And that's fine. That's really how our country runs, more or less. I have no problem with that, except that when it comes to things like testing, they no doubt think about price points and what people in the marketplace are willing to pay. And for that reason, they're just not going to offer thorough testing. It's just
Mm,
that simple. Thorough testing is much more expensive. I mean, you can go down to CVS and get for $60 something that they're calling an STI panel. It tests for like three things. ours tests for 14.
Mm.
And I once talked to a funder and he said, "Well, Robert, you might have to listen to the marketplace. I mean, you're selling a very expensive
Mm.
STI test. Maybe you need to lessen that down and let people make the choice." And of course, the problem I have with that is if you think about an infection like Mycoplasma genitalium,
Mm.
how many people even know what that is? Not many.
Yeah.
Well, it's a pretty serious STI. It causes a lot of problems. It almost triples your likelihood of contracting HIV, amongst other things.
Mm.
And so I think it should be included in a panel. We included in ours. I could offer a less expensive test without that. But then I kind of think, what would the point of our company be? If we're not offering very thorough STI testing, then what are we? We're just another one of these companies that are all
Mm.
kind of doing the same thing.
Very true. Very truly said. Yes. And then, like, do you think like it's just the discomfort, or there is some profit motive in keeping things vague? So,
Yeah, I absolutely agree. I mean, these companies that sell genital only gonorrhea testing, for example, I would have absolutely no problem with that if they would tell consumers that. If they would say, this is only going to test your genitals, or if
mm,
you have oral sex, this may not catch, everything that you could have. But
mm,
generally speaking, they make no attempt to tell consumers that. They just say, test for gonorrhea, test for chlamydia. And that's true, but only in one of three locations. And I just don't think, unfortunately, your average customer, if you will,
yeah,
understands that.
exactly, exactly true. Yep. Oh, and like you're also open about being part of the swinging and consensual non-monogamy community for decades. So, how has that experience shaped your views on the consent, trust, and testing?
Absolutely. Well, it's interesting for sure. I mean, I think that people who consider themselves to be swingers are very proactive about testing and really want to do the right thing, and not just from their own health benefit, but from just not wanting to hurt their friends. And because of that, they're often, really proactive. One of the things I think that just watching well, way more people have sex than I ever wanted to, like way past the point that it's titillating or even interesting. And one thing that may set me apart from owning a a telemedicine company versus somebody else is just the sheer number of people that I have seen
Mm.
be intimate. It is understanding the fluidity in which a lot of people
Mm.
switch from unprotected oral sex to protected penis and vaginal sex or penis and anus sex. So people put a lot of faith in condoms. Um, but most people, as I talked about earlier, I personally believe have unprotected oral sex. And what people often do is they'll have unprotected oral sex. They'll then put on a condom, use that condom for penis and vaginal sex, but then take that condom off and have more oral sex
Mm.
and back and forth. And this opens up tremendous opportunity for bacteria spread and some virus spread because they're switching back and forth from barrier protected sex to not. And I think this is why we see infections like Mycoplasma genitalium, where it doesn't immediately make sense that that would live in the throat. But we see people test positive for that, even though they are reporting 100% barrier usage. And I think what may be happening there is that they are using condoms for penis and
Mm.
vaginal sex, but they're going back and forth so often from oral sex to penis and vaginal sex that it may be causing some additional spread there that people don't really realize.
Mm.
When I read, sexual health journals and things like that, peer-reviewed scientific journals, it's clear to me that researchers tend to think of oral sex as like, okay, you have oral sex with that person and that's all you did. From start to finish, that's all you did.
Yeah.
Or penis and vaginal sex, okay, you have penis and vagina sex and that's all you do. But sex in the real world is very fluid and people do a lot of things and a lot of back and forth things and that can lead to some interesting infection spread sometimes. So I think just the sheer number of people that I have seen
Mhm.
actually do this, which is much more than I wanted to. I used to do consent watches and things like that in playrooms and make sure that people were being safe and respectful and communicating with each other. And as a result, I've seen way more sex than I ever wanted to, but I think it's given me a much real world view of how people actually do these things.
Uh, True, exactly true. Yep. And like in spaces like where multiple partners are the norm, uh, how do people talk about safety, and where do they fall short?
It's pretty interesting. I mean, I don't know that a lot of people do talk about safety in terms of, okay, when was your last STI test? What was on that STI test? A few people do, but not nearly as many people as they should. I think that in most circles, and I'm really only familiar with mine, which would be the swinging lifestyle circle, but there are other communities out there for sure. And I think every community has a basic set of expectations. And for people in the swinger community, that tends to be, okay, we're going to have a couple A and couple B. They hit it off. They agree they're all going to go have
Mm,
sex, and that's probably going to be unprotected oral sex and protected, penis and vaginal sex. That seems to be like the expectation.
yeah.
And then if anything is outside of that, then then somebody might speak up and ask some questions. But rarely does anybody ever actually stop and ask the really important question, which is, hey, my wife and I were STI tested for these 13 things. Go ahead and list them. We did that last month. When was your last STI test? I just don't think that
Mhm.
conversation happens a lot, and it certainly should.
Mm, agree, totally agree on this. Yeah. So, and also about if we talk about the, like, I want to touch on the emotional side of the sexual health also. So, you were unknowingly a transmitter once, but how did you process that guilt? And uh, what would you say to others who find themselves in that position?
Well, that's a great question and a very thoughtful one. For me personally, it was kind of a relief. And I know that sounds probably crazy, but I had really feared getting an STI, my entire life. And I would have assumed that once I
Mm,
had one, that I would have felt really dirty and guilty and that sort of thing. But I just didn't. And part of it was because it was completely asymptomatic, so I wasn't sick, I didn't have to rush off to the emergency room. I was also fortunate that I had one that was completely curable. In the United States, you get an intramuscular injection of antibiotics and that's it. You're cured. You're back to good, as if it never happened. But I think more than anything, and this might help other people, it made me realize that, something like gonorrhea and chlamydia, it's just a bacterial infection. It's really no different than if you went to I don't know, a pool party and got too close to somebody and came down with strep throat. What is that? That is a bacterial infection you caught from somebody else that's curable with antibiotics. Well, guess what? That's exactly what gonorrhea and chlamydia is. It just wasn't as big of a deal to me after I got it. Now, clearly it impacted me because I've invested my life savings into a company to try to fix this problem that may never be profitable. Who knows? I'm working my butt off every day, but
yeah.
like a lot of entrepreneurs, it's a gamble. And I knew that going into it. So it impacted me, but it didn't make me feel
Mm,
particularly guilty or dirty. It actually did the opposite. I think it kind of helped put it into perspective a little bit.
true. So, do you think that guilt is useful, or is it just another way shame keeps us silent and seek?
That's a great question. I mean, we certainly have patients that test positive for STIs and respond in in kind of extreme ways, and I feel really bad for those people, and that is clearly not because of the medical outcome that happened, but because of, thinking their entire life that getting an STI made you a bad person, and maybe some holdover from sexual education or maybe some religious upbringing that they had. But the way that they react is clearly not um,
Mm.
commiserate with the actual health outcome, if that makes sense. Um,
Understood.
but for me personally, it was incredibly motivating,
Mm.
obviously, because I,
Mm.
setting my issue aside, I'm one of just several million people in the United States per year who get these infections. So what does that matter? Except it just mattered, except I could so clearly see the problem with
Mm.
people having oral sex, going and getting tested because every public health message is go get tested, blah, blah, blah. And then them not getting tested for the very place they're most likely to have an infection. I just clearly saw the problem and felt compelled to do it.
Mm. True. Exactly. Ah. And also, this sounds contradictory, but it's actually not. Like some critics argue that radically accessible STI care could encourage reckless behavior. So, what do you say to those who think services like yours are enabling?
I think it's um, not understanding history.
Okay.
If the people STIs have been around
Uh-huh.
forever, and if you think about an infection like syphilis, it wasn't that long ago that syphilis was a lifelong chronic infection that would eventually kill somebody after making their nose fall off and them go insane and like a bunch of like really horrible things. And yet people still had sex and they still got syphilis. I'm from the Midwest part of the United
Mm.
States, and part of how Lewis and Clark, and for your listeners that aren't maybe familiar, Lewis and Clark were two explorers. And when the United States expanded from basically the Mississippi River all the way to the West Coast, these two gentlemen, along with some other explorers, went out to essentially find a passage to the Pacific Ocean. So they went on this vast, 2,000-mile journey through complete wilderness, and that happened in 1804. And one of the ways that researchers can exactly pinpoint their camping locations is by finding mercury. And why was mercury there? Because they were using it to
Okay.
treat their syphilis infections by injecting this mercury into their penis.
Oh.
And so it just goes to show that even when
Mm.
even when these infections were completely uncurable
Mm.
and a death sentence, people were still having sex and they were still catching these things. And so I find the idea that treatments and preventions just furthers bad behavior to be kind of nonsensical from that standpoint.
Mm. Got it. Got it. So, wow, that's really amazing. So, Robert, thank you so much for your raw honesty, humor, and your refusal to sugarcoat the truth. So, um, to everyone who is listening, your sexual health is not a taboo. It's not a shameful thing. It's vital. It's valid, and uh, it's your own. Yeah. So, whether you are a monogamous, swinging, polycurious, or just figuring things out, test better, love smarter, and leave shamelessly. And so, Robert, if someone wants to connect with you, how they can connect?
They can go to shamelesscare.com, and we certainly have great testing, but we also have an outstanding testing resource that I would like to tell people about. So we realize, of course, that our STI testing kit is $300 and that's not inexpensive. It tests for 14 different infections. But we have a resource on our website that anybody can find that can help you get that same level of testing from your doctor without having to pay us at all. And it even has a video in there from a doctor that you can show your doctor in the exam room in case your doctor looks at you and
Mhm.
says to you what my doctor said to me, which is throat swab. What the hell is that? And it's a little 60-second video where the doctor basically explains what a throat swab test is and how to do it and what swab to use and how to code it in their medical system. So any doctor in the United
Mm.
States can do a throat swab test if they watch this little 60-second video. So that's available right there for free on our website. And we also have a whole host of prescription medications, including topical Viagra cream for women, which has been really popular, and a whole lot of resources for you over at Shameless Care.
Wow. Lovely. Great. So I'll put all the links into the show notes, dear listeners, for your easy reference. And as always, Share this episode with someone who needs to hear it. Subscribe and leave us a review. Let's keep breaking silence and building a culture of courageous and connected pleasure. So, with this hope, until next time, this is your host Avik signing off from Pleasure Principles. Take care, be happy. Thank you so much.